One thing I've learned from all my years working with senior citizens, including me, is that has a concern about their memory. We want to keep it intact, but the truth is things do change as we age. So the question is, what's normal, what's not normal, and what can we do about it? Well, if you want to know more about that, just stay tuned. Hey, good morning, everyone, and welcome to Scan FYI. My guest today is Dr. Megan Glenn. Good morning.
Good morning.
Well, thank you so much for being with us and really talking about an issue that so many people have questions about. And before we even get into anything, Dr. Glenn, would you kindly introduce yourself? Tell us you're a neuropsychologist. Please explain what that is. And what is your role in working with Hackensack Meridian?
So thank you so much for having me. I'm a neuropsychologist. So by training, I received a doctor of psychology in clinical psychology. So sort of like how a medical doctor goes to school for their general medical education, and then they specialize in a certain area.
Mhm.
Uh, that's like with clinical psychology, we can specialize in a certain area, and mine happened to be neuropsychology. Um, so, the definition of a neuropsychologist is somebody who specializes in the brain and behavior. Um, as we all know, the brain is really responsible for everything that we do, our thinking and memory abilities, our movement, our personality, our seeing and hearing and feeling. And so being able to assess what is normal brain functioning versus not normal brain functioning is my specialty. And I specifically specialized even more so in geriatrics. So at Hackensack Meridian Health, I'm a geriatric neuropsychologist. So I work with older adults to help tease apart what is normal age related thinking and memory changes versus what might be something more concerning.
And naturally, everyone is concerned. I mean, this is the control center of what makes us a human being, and things do change. Let's get real. Things do change, but that's the first really big question. What's normal, and when do we have to say, "Oh, I better do something about that"? That's the first question.
Yeah, so it's helpful to think of cognitive aging on a spectrum. Um, so from normal age related memory changes that are universal, we all experience.
Right.
As we get older, it's normal to have some minor memory lapses, trouble thinking of words. That's just part of getting older. Um, so that's a gradual kind of lifelong process where our thinking speed might change, our attention isn't quite as sharp. But other skills I like to mention, such as vocabulary, wisdom, can remain stable or even improve.
Wisdom, wisdom,
There's
yes.
also improvement as we get older. So then that's the first part of the spectrum, just normal cognitive aging. We all do it. The second part of the spectrum, I would say, is mild cognitive impairment. So it's a step beyond normal aging where a person experiences more memory and thinking problems than expected for their age, but they can still generally function independently, care for themselves, get around, participate in hobbies, activities. They may just need a little bit more effort, or they may need to use some more strategies like writing themselves more notes and reminders. But in general, they're still functioning okay. Um, and then the third stage on the cognitive aging spectrum is
Can
dementia.
I ask a question? I'm going to interrupt you. So when if you're in the stage where mild cognitive impairment, is it likely that I could notice or I could have the realization that something isn't right? Or is it something that other people are going to probably notice more than I will notice?
So I honestly, with patients, I see a combination. It can be very different depending on the person. There's some people who notice the slightest things very early on in themselves, and others may not notice. Or I see the other way around, where family members notice they're really concerned that their loved one is showing some changes, but the individual doesn't notice it as much in themselves. So it really kind of depends. And that's all kind of part of the changes going on in the brain. Sometimes they affect areas that also impact our self awareness. So that's why it's good to educate ourselves in what's normal versus not normal, so that maybe we can, boost our awareness and be able to look out for some of the signs. Um, but also not freaking ourselves out too much over
Yeah,
normal.
yeah, exactly,
It's a
exactly.
balancing act.
All right, so I had interrupted you. Now you were going to talk about what is abnormal? What these are the normal changes that we can expect. Now what is the abnormal part?
Yeah. So mild cognitive impairment, I would say it's starting to be considered abnormal. There are some changes that are more than what you would expect for aging, but you're still functioning pretty well. And then I would say the kind of third stage on the spectrum is the dreaded dementia, where thinking problems become more severe to the point where we're not able to function or take care of our daily responsibilities without assistance. Um, in terms of what is kind of, I like to give some examples of what's normal versus not,
Yeah,
because it's
please.
hard to know. Um, so some common things, I have a lot of people come in and tell me, I set out to do something. I go to walk into the kitchen to get something, and I get there and I completely forget what it was that I was gonna do.
Guilty.
Um,
We all that's I think we all relate to that one. Yeah.
yeah. And that is very normal. And I like to point out that it's not so much a memory problem as it is attention. We're all constantly thinking of a million things or getting distracted. And usually we eventually remember, oh, yeah, I remember what it was that I went into the kitchen for. It usually comes back to us. It's more of a concern if, you start working on a project, say, you start cooking a meal, leave the kitchen, and just completely forget that you were doing that at all.
Maybe you left the stove on.
Maybe you left the stove on, and maybe you go start watching TV, completely forget, and the only thing that reminds you is maybe a loved one comes in the kitchen, or you start smelling something burning, and you just completely forgot. Like, even smelling something burning didn't even remind you that you were even cooking in the first place. It's like that memory is completely gone. Um, so that's one important difference as well. Usually, with normal aging and mild memory changes, you might forget something, but if somebody reminds you, like, oh, don't you remember we talked about X, Y, and Z? And you're like, oh, yeah, yeah, I remember that now. Or
Mhm.
if you can't think of the name of a movie, but it comes back to you in a few minutes, that's relatively normal.
So
Um,
if something isn't right and you do find yourself in a situation where you go to the doctor, and by the way, all of Dr. Glenn's contact info will be in the show notes. But let's say we come to see you. What are the tools that you're using to diagnose people?
so, as a neuropsychologist, we specialize in testing, and testing can sound scary, but it's nothing invasive. It's all mostly paper and pencil based tests. We're pretty old school. We have some occasional computerized tests, but really we have mostly paper and pencil tests that have been designed and researched, um, knowing that we're able to detect whether these scores on these tests are actually correlated with brain functioning. So tests, it may be a lot of us, have annual wellness visits with a primary care provider, and I think Medicare now requires a brief cognitive test. So many people are familiar with the remember 3 words or draw a clock that primary care providers often have you do. So that's a very brief example of the testing we do. But the testing is designed to look at things like memory. So, for example, we might have you try to remember a list of words or a story or pictures. We look at all other skills as well, like your attention span, how quickly you process information, hand eye coordination, language skills, visual skills, problem solving skills. We want to get a full picture of your strengths and weaknesses, and then we compare your test scores to other people who are about the same age as you, which was the real strength of our testing. That's how we distinguish what is considered normal age related changes
Okay.
versus something more pathological.
So sadly, it's not as simple as a blood test. We wish.
We
Yeah.
do there are blood tests on the horizon. As a neuropsychologist, I'm not a medical doctor, so I don't personally order brain scans, blood tests. Though that's an important piece of a comprehensive evaluation for the cause of memory loss. Um, Dementia is a very broad term, and memory loss is a very broad term. You want to know what is causing that memory loss because there can be so many causes. So that's why it's important to work together with our other colleagues in primary care and neurology who can run blood tests to make sure there's nothing out of balance. Like, for example, vitamin B12 levels being low, thyroid levels being off. Those can contribute to memory loss. So those are things that you do want to have looked
Hmm.
at. It would require the primary care medical provider to order those things. Um, there are also new blood tests that can detect changes, suggesting you might be at risk of developing Alzheimer's. But those are specialty tests that we're kind of very careful about ordering because we're still learning about them and there can be false positives. So, specialists in neurology are the ones that order those because you have to be very savvy in how to interpret them.
So one of the questions and I hear that people talk about this a lot. Again, working with older adults. So when you hear the term dementia, which I guess is like the umbrella term for just about everything, uh,
Exactly.
that doesn't mean you have Alzheimer's.
Correct.
And could you kind of explain? I feel like when people hear that word, it immediately in their mind goes, "Oh, Alzheimer's."
Hmm. Yeah, and that is the most common misconception, but it makes sense because I think the two were talked about synonymously for so
Yes.
long.
Yes.
Um, so dementia, like you said, is an umbrella term. So think of it like if you were talking about a virus. Somebody tells you I have a virus, you want to know, okay, well, what kind of virus do you have? COVID, flu, the common cold, and knowing which type of virus tells you what symptoms to expect and what treatment would be most appropriate. So that's similar to dementia. Dementia is an umbrella term that refers to changes in thinking and memory that are severe enough that it's starting to impact your daily functioning and you're starting to need help with things. So significant thinking changes. Different types of dementia, the most common type is Alzheimer's disease. And I think that's why for so long the two were talked
Yeah.
about as one and the same because it was before we kind of knew about all the other different types of dementia. Alzheimer's is the most common, and the most common feature of Alzheimer's is memory loss. So that's why it's, the big one on people's minds, because it is the most common and accounts for usually the cases that have significant memory loss. There are other types of dementia, though. For example, blood vessel disease, vascular dementia, and other ones like dementia with Lewy bodies. Parkinson's disease can cause dementia eventually, frontotemporal dementia, lots of others.
But again, most people just think of Alzheimer's, and we have to stop doing that. Definitely. Well,
Mhm.
another question that comes up a lot is, so are there preventive measures that people can take that would make it so that you don't ever get dementia or Alzheimer's, let's say, or I don't know, is that just a myth?
No, it's really exciting. Preventative medicine is really exploding in the field of memory loss and aging. I think there was a Lancet Neurology, big journal, medical journal report a couple years ago that suggests potentially 30 to 40% of cases of dementia may be preventable. Um, and these are by various, mostly lifestyle health strategies. Um, so, one big one, I think the one that may have the most evidence for helping to slow down or reduce your risk of developing dementia is exercise. So, physical exercise. And it doesn't have to be running a marathon, or being a weightlifting champion. There's studies that have shown just, going for walks a few times a week can really be beneficial for your brain and your memory, potentially even help your brain build new brain cells. So exercise really is medicine. Um, Also, taking care of your heart. Anything that's good for your heart is good for your brain. So, making sure blood pressure, cholesterol, blood sugar, diabetes are all under control, getting regular blood work and treatment for those conditions. Um, Diet is important. The most researched type of diet is the Mediterranean diet, for helping with brain health. Sleep is very important. So, getting adequate sleep,
Mhm.
but also making sure you don't have any sleep disorders, the most common being sleep apnea. Typically, people who snore or gasp for air when they sleep, their brain is being deprived of oxygen, and that can really increase your risk of developing dementia. And then the other biggies are just, keeping your mind active. So being mentally active, socially active. It's kind of like if you think of the brain as a muscle, if you don't use it, you'll lose it.
Mhm.
Um, so staying mentally active and connected socially, our brains really crave social interaction. All these things, especially if you combine them together, can really help to reduce your risk of dementia or potentially slow down memory loss.
Well, I think we could say that anything that's going to be good for your body and your general health is going to be good for your brain. And anything that's not so good for your body is probably not going to be good for your brain.
Right. It's all connected. It really is.
Absolutely. Well, Dr. Glenn, thank you so much for being my guest today. I feel like this is a topic that everyone benefits from. And by the way, our theme for our April 23rd Brain Health Fair at SCAN is going to be the importance of, physical activity and socialization, how that affects your brain health. And that's just what you were talking about.
Oh,
So,
that's amazing.
yeah, that's our topic this year. So again, Dr. Glenn's contact info, it's all in the show notes. Feel free to reach out to her because you know, there's things you can do. It's just important to take care of yourself. That's the main thing, right?
Absolutely.
So remember, if it's important to you, it's important to us. I'm Andrea Tarr. We'll see you next time on Scan FYI. Bye everyone and bye Dr. Glenn.
Bye. Thank you for having me.